afternoon. Today is May 30th, 2023. Welcome to the first episode of the Stat Regimen of Season 8, a series that provides recent updates on all things public health current to Rhode Island. My name is Ashley Chiarello, and I'm a final year pharmacy student from the University of Rhode Island.
And I'm Jeff Bradberg. I'm a clinical professor at the College of Pharmacy and an academic collaborations officer at the Department of Health. Opinions expressed in the podcast by the host don't represent the opinions of the United States government, the University of Rhode Island, or the Rhode Island Department of Health.
Today, Dr. Bradberg and I will be discussing a recent FDA-approved intranasal long-acting opioid antagonist, Nalmefene, also known by the brand name Opvi. Currently, naloxone is a short-acting opioid antidote used to treat overdoses. How does it compare to the efficacy and safety of naloxone?
Well, Nalmefene, by its definition, it's a long-acting opioid antagonist. It works quickly to reverse the respiratory depression or the breathing emergency that opioids cause and lead to overdose. So they both work quickly. They both work well to put a person into breathing normally, but it also can cause withdrawal. And if it's a long-acting form, the withdrawal will be longer as well as the relief of that overdose. So I would say that they're probably equal in relative safety, equal in relative efficacy in the opioid overdose reversal space. One being short-acting, that's naloxone, and one being long-acting, Nalmefene. They're quite different in that regard.
These medications save lives by quickly blocking opioid receptors, resulting in breathing restoration and also opioid withdrawal. How will opioid withdrawal symptoms look like with Nalmefene as compared to naloxone? Right,
so that's the big difference here, is that opioid withdrawal is actually a pretty dangerous condition, not as dangerous as alcohol withdrawal. One of the key characteristics is that the person will be vomiting, the person will have diarrhea. If it's a short-acting naloxone, and let's say they're getting pain relief from the opioids, they'll also be in pain, but as the naloxone wears off, usually the person is safe to be recommended to a treatment program or something like that. And the withdrawal, which can last for days or weeks, usually fades over time. With Nalmefene, if it works for, exceptionally, 20 times as long as naloxone, you're going to see those withdrawal symptoms last and last and last. This is going to create discontent with the responders that are helping them. As the intranasal form looks like naloxone, there'll probably be confusion. The names are also confusing. So I really don't see that there's a gap that Nalmefene is filling here, and that the long-acting withdrawal will have greater consequences than benefits for both the community and the patients being revived by these new medication.
Will Nalmefene be covered by insurance plans?
Probably not. Naloxone has generic forms, it has branded forms, it's soon to have an over-the-counter form. Nalmefene doesn't have any of those things, so it's probably going to be some time, if ever, that insurance companies cover it.
As a healthcare professional or pharmacist, it is important to stay up to date with new medications on the market. Thanks for joining this week of the Stat Regimen on Opvi or Nalmefene, which is a long-acting opioid overdose antidote.